Good day everyone, I am Marvel Makatambad, the leader of Group 7. Together with me are my groupmates, Maambong Maria Isabel, Japson Judian, Gonzalez Justin Jules, Lianyo Dixay, and Haji Omar Saina. To talk about Chapter 10, Students with Hearing Impairment by Yolanda T. Capulong. Objectives. At the end of the chapter, students are expected to first define the terms hearing impairment, hearing loss, deaf, and hard of hearing. Name the parts of the hearing mechanism and their functions. Describe the normal process of hearing or audition. Explain the role of hearing and listening in language development. Enumerate and describe the causes and classifications of hearing loss. Explain the effects of hearing impairment on intellectual, social, and emotional development. Enumerate and describe the formal and informal hearing test. Enumerate and describe the assessment procedures in determining the cognitive ability, communication skills, and socio-behavioral traits of students with hearing impairment. Students with hearing impairment, either deaf or hard of hearing. Students who are deaf do not have sufficient residual hearing to understand speech without special instruction or training. On the other hand, students who are hard of hearing have enough residual hearing to understand speech and learn in a regular class without much difficulty. So let's talk about the definition of hearing impairment or disability, deaf and hard of hearing. Hearing impairment or disability refers to the reduced function or loss of the normal function of the hearing mechanism. The impairment or disability limits the person's sensitivity to tasks like listening, understanding speech, and speaking in the same way those persons with normal hearing do. According to the age of onset, hearing impairment can be congenital when the condition is present at birth or adventitious when it is acquired after birth or later on. When the condition occurs before the child learns to talk, deafness is prelingual. Deafness is postlingual when it is acquired after the child has learned speech, usually at the age of 2. The second one is deaf. A person who is deaf cannot use hearing to listen, understand speech, and communicate orally without special adaptations, mainly in the visual mode. While a hearing aid amplifies the sound by increasing the volume to make the sounds louder, a person who is deaf cannot understand speech through the ears alone. They may be able to perceive some sounds, but their sense of hearing is not enough or non-functional for ordinary purposes in life. Speech is accompanied by visually perceived actions like gestures, signs, and through facial expression. The third one is hard of hearing. A person who is hard of hearing has a significant loss of hearing sensitivity, but they can hear sounds, respond to speech, and other auditory stimuli with or without the use of hearing aid. They are more like a hearing person than one who is deaf because both of them use audition or listening to auditory stimuli in the environment, unlike a deaf person who relies more on visual stimuli. So now let's move on to our next topic, which is about the anatomy and physiology of the human ear. Audition. Audition is the act or sense of hearing. The ear is one of two lead sense organs that allows a person to gather auditory stimuli and information from near and far sources in the environment that come in the form of acoustical energy. Audition transforms acoustical energy into a form called mechanical energy and finally into neural energy or nerve impulses that can be interpreted by the brain. Neural energy is called the language of the brain. Hearing for most people is natural and automatic, but hearing impairment makes listening, observing, understanding, and reacting to others extremely difficult. Now, the ear has three main parts: the external or outer ear, the middle ear, and the inner ear extends the central auditory nervous system in the brain. The external or outer ear, called the auricle or pinna, directs the sound into the auditory canal or external acoustic meatus. When the sound enters external acoustic meatus, they are slightly louder or amplified as they are directed toward the middle ear. Sounds enter the middle ear through the eustachian tube and pass through the tympanic membrane or eardrum. The eardrum moves in and out in response to changes in sound pressure. The movements of the eardrum change the acoustical energy into mechanical energy, which is transferred to the three smallest bones in the body: the ossicles or ossicular chain, composed of the malleus or hammer, incus or anvil, and stapes or stirrup. The footplate or base of the stapes rests in an opening called the oval window, the path through which mechanical energy enters the inner ear. The vibrations of the ossicles transmit the mechanical energy from the middle ear to the inner ear with a little loss. The most complex and sensitive part of the entire hearing apparatus is the inner ear, is covered by the temporal bone, the hardest bone in the body. The cochlea is the main receptor organ for hearing and contains two fluid-filled cavities and the organ of Corti. The vibrations stimulate approximately 20,000 tiny hair cells to transform the mechanical energy into electrical nerve impulses or neural energy. These impulses are transmitted along the auditory nerve through the central nervous system pathways to the brain, where the auditory experience is processed and understood. The semicircular canals in the inner ear control the sense of balance. Classification of hearing impairment. So there are three types or classifications of hearing impairment. The first one is conductive hearing loss. It occurs in the outer and middle ear, thereby blocking the passage of the acoustic energy. The blockage may be caused by abnormal growths or complications of the outer or middle ear. Conductive hearing loss happens when the natural movement of sound through the external ear or middle ear is blocked, and the full sound does not reach the inner ear. Conductive loss from the exterior ear structures may result from earwax. Your body normally produces earwax. Conductive hearing loss causes range from earwax to ruptured eardrums. Working with your doctor will ensure you can identify the root cause of your hearing loss and decide on the proper treatment. Conductive hearing loss can happen anytime something prevents sounds from getting across the outer ear and the middle ear. The next one is sensorineural hearing impairment. Occurs in the inner ear. The sensitive mechanisms in the auditory nerve may be damaged. When the cochlea is impaired, the neural energy delivered on the brain is distorted or not delivered at all. Sensorineural hearing impairment affects both the loudness and the clarity of the sounds you hear. You may also experience a reduced range of sounds you find comfortable, meaning soft and normal sounds are too soft, but loud sounds very quickly get too loud and may really bother you. Sensory neural hearing impairment is permanent. No surgery can repair damage to the sensory hair cells themselves, but there is a surgery that can bypass the damaged cells. And the last one is mixed hearing impairment. It results from the combination of both conductive and sensory neural hearing losses. Any dysfunction in the central auditory nervous system between the brainstem and the auditory cortex in the brain results in a central hearing disorder. Another basis for classifying hearing impairment is its being unilateral or present in one ear only, or bilateral or present in both ears. Sound is measured in decibels or units that describe its intensity, that is, its loudness or softness. 0 decibels represents the softest or faintest sound that a person with a normal hearing can hear. Larger decibels numbers represent the louder sounds. So now, the following table shows the intensity of sound as heard by the persons who have hearing impairments. The severity or degree of the hearing loss corresponds to losses in decibels that result to learning difficulties. So we have here the degree of hearing loss, its decibel loss, and its resulting impairments. So in normal degree, it has 0 to 20 decibel loss, and it has no resulting impairments. In slight degree of hearing loss, it has 27 to 40 decibel loss, and its resulting impairments is faint sounds and distant conversations are difficult to hear. With a hearing aid, the student can attend a regular school. In mild degree, it has 41 to 55 decibel loss. As much as 50% of classroom conversations are missed. Limited vocabulary and speech difficulties may result. In moderate degree, it has 56 to 70 decibel loss. Loud conversations can be heard. Defective speech, language difficulties, and limited vocabulary may result. While in severe degree, it has 71 to 90 decibel loss. Hearing is limited to a radius of 1 foot, enough to discriminate loud sounds. Defective speech and language and severe difficulty in hearing consonant sounds may result. And lastly, in profound degree of hearing loss, it has 91 and above decibel loss. Its results impairment is that sounds and tones cannot be perceived. Visions become the primary sense of communication. Speech and language are likely to deteriorate. So finally, we are down to my last topic, which is about incidence and prevalence. So here in the Philippines, the conservative estimate is that 2% of the population has an hearing impairment, and the number may increase if children below school age and persons who lose hearing sensitivity due to old age are included. While in the United States, at least 1 in every 22 newly born infants has some degree of hearing impairment. At least 3 in 1,000 infants have a severe or profound hearing impairment. In its latest report, the U.S. Department of Education claimed that children with hearing impairment constitute 1.3% of pupils provided with special education services and 11% of the total age population.
Everyone, I am Maria Isabel Maambong from Section Y1AMGO4, BS Ed Major in Filipino. Ang tatalakayin po natin ngayon ay tungkol sa etiology of hearing impairment. Etiology of hearing impairment. Hearing impairment are attributed to genetic and heredity factors, infections, environmental, and other traumatic factors. Some hearing impairments have unknown causes. Genetic heredity. Genetic heredity types of deafness occur in 1 out of 1,009 births. Causes are hereditary and chromosomal abnormalities. Infections. Infections such as maternal rubella, cytomegalovirus, hepatitis B virus, syphilis, mumps, and otitis media may occur during pregnancy or after birth. Adventitious hearing loss. Adventitious hearing loss can be attributed to environmental factors such as excessive and constant exposure to every loud noises. Drugs and medication that can turn toxic when administered to the mother or to the child at inappropriate times and circumstances. Traumatic factors. Traumatic factors can cause hearing impairment at birth. Low birth weight, difficult and prolonged labor can traumatize the hearing mechanism and cause hearing loss impairment, damage to the ear. The more specific cause of conductive hearing loss are otitis media or the middle ear infection, excessive earwax, impact cerumen, and otosclerosis as pangibangi growth around the stirrup which impedes its movement. Sensorineural hearing loss. Sensorineural hearing loss results from the damage to the cochlea or the auditory nerve. Other causes are viral diseases, RH incompatibility, heredity factors, exposure to noise, aging, and ototoxic medications. Common disorders that cause hearing impairment are discussed in the following table. Absence of the external ear canal, usually unilateral or found in the both ears, often seen in the conjunction with such syndromes as Curzon's teacher Collins Penny-Robin, usually congenital but can be acquired, fungal infection, squamous cell carcinoma, results in conductive hearing loss. Cystic neuroma, benign slowly growing tumor associated with NF-2, chromosomes 22, autosomal dominant. It is found in the internal auditory canal, have prevalence 1:100,000, 75% have slow progressive sensorineural hearing loss, and other symptoms include poor speech understanding in the affected side, facial numbers, and unsteadiness. Tala, hole in or rupture of the oval or round window in the inner ear, may leak perilymph or clear fluid into the middle ear, caused by head injuries, diving, barotraumas, violent sneezing, and etc. Result in fluctuating and or sudden sensorineural hearing loss. It can be a complication of cholesteatoma. Dizziness can also be a symptoms. Autoimmune disease associated with a variety of immune disorders such as HIV or AIDS. May be accompanied by chronic otitis media, nasal crusting, cough, arthritis, and etc. Sensorineural hearing loss occurs in 20% of the patients. That's all for my report. Thank you for listening, and I will pass to the next reporter.
Good day everyone, I am Dexigers Ashley Anyo and I am your next reporter for this subject. My topic is all about educational placement. The overall instructional settings in which the student receives his education include the special education and related services provided when a general education placement is the best match for a student's needs. Students participate in more complex, natural settings that affords almost continuous opportunities for generalization, that is applying new skills to different people, environment, and setting, which is critical for students with autism. Language alphabet. As what you can see, mayroong mga sign language na ginagamit para sa mga deaf or yung mga taong may autism. So, sign language alphabet, the American Sign Language is an alternative forms of language used in the USA, having its very own grammar. Sign language alphabet and letters is primarily uses hand gestures and visual movements to replicate the alphabet and words. Next is Table 5 Guidelines on Educational Placement of Student with Hearing Impairment. In the first column, as what you can see, there is a degree of hearing loss based on the modified pure tone, average to 500 to 400 Hz. And the second column, nagpapakita ito ng possible effect of hearing loss on the understanding of language and speech. And the third column is ang possible psychosocial impact of hearing loss. Sa mga possible niya nga impact. And the fourth column, potential educational needs and program. Kanito mga needs na kailangan sa mga students nga na ay mga hearing loss. So, sa degree of hearing loss, mayroon tayong normal hearing. Meron itong negative 10 to positive 15 dB or HL. Dito sa possible effect of hearing loss on the understanding of language speech, a child with hearing sensitivity in the negative 10 to positive 15 dB range will detect the complete speech even at soft conversation level. And the possible psychosocial impact of hearing is wala siya. And then sa potential educational needs and program, wala po kailangan kay normal ang iyahang hearing. Minimal order line 16 to 25 decibel hearing loss may have difficulty hearing faint or distant speech. The child may have immature behavior. Child may be more fatigued than classmates due to listening effort needed. This child need attention to vocabulary. Teacher requires in service on impact of hearing loss on language development and learning. For mild 26 to 40 decibels hearing loss, children with 35 to 40 decibel may miss at least 50% of class discussion, especially when the voice is faint. A child may not paying attention due to the barrier begin to build a negative impact on self-esteem. The child need attention to vocabulary development, articulation, teacher need and service required. For moderate 41 to 55 decibels hearing loss, the child understand the conversation speech at distance of 3 to 5 feet face to face. A degree of hearing loss, the communication is significantly affected and socialization appears. Special education support for primary children, the child need attention to oral language development, reading, writing, and speech. And the next is moderate to severe. 56 to 70 decibels hearing loss without amplification. Conversation must be very loud to be understood. Full-time use of hearing aid FM system may result in child being judged by both peers and adults as a late competent learners, resulting in poor self-concept, social maturity, and sense of rejection. Full-time use of amplification is essential, may require special help in all language skills, vocabulary, grammar, pragmatics, as well as reading and writing in service of mainstream teacher required. For severe 71 to 90 decibel hearing loss, without amplification, the child may hear loud voices about 1 foot from children with hearing ability of 90 decibels should be able to identify environment sounds and detect sounds of speech. Child may prefer other children with hearing impairment as friends as playmate. We need full-time special oral program for deaf children with emphasis on all auditory language skills, speech reading, concept development, and speech. And next is profound 91 decibel hearing loss. Aware of vibration more than tonal pattern, many rely on vision rather than hearing a primary revenue for communicating and learning. Depending on oral competence, peer use of sign language, parental attitudes, and etc. Many deaf children need special program and emphasis on language skills and academic areas. For unilateral, one normal hearing ear and one ear with at least a permanent mild hearing loss may have difficulty hearing faint or distant speech. Child may accuse of selective hearing due to discrepancies in speech understanding and quiet versus noise. Cross hearing aid may be of benefits in quiet settings. Next is educational placement. Students with hearing impairment, like other students with disabilities, are mainstream in regular classes either on full-time or part-time basis. So in the Philippines, special education teachers assist the regular teachers and seeing to it that the students receives as much instruction as interpreter in the regular class who translate the verbal activities into sign and gestures to enable students to follow the lessons. And the next topic is support services. Support services communication accessibility is provided by sign language and oral interpreters inside and outside of the classroom. Computer aided instruction reinforces the knowledge and skills learned in the training, and language are taught effectively through computer aided instruction. So, some TV programs and videos utilize closed captioning services and sign language that make the program accessible to individuals with hearing impairment. Telephone services having telecommunication devices for the deaf where visual display of communication going on is available in a print and electronic display. Cellular phone with text message features are very useful to individuals with hearing impairments.
That's all. Thank you.